Hi everybody, my name is Alex Weil and I am a junior psychology major and sociology minor. My paper topic is about mental health and mental illness perceptions across the world. So I just wanted to start off with some statistics because I know we have some numbers people in the room. So the United States population is 319 million. We have 406 psychiatric hospitals and a total of 5,686 hospitals, like what you would normally think of when you think of a hospital. However, in South Africa, there are 52 million people and only 22 psychiatric hospitals, with a total of 4,200 hospitals, like, again, what we would normally think of when we think of a hospital. And for me, I find this really hard and difficult to comprehend because when somebody has a physical ailment, we automatically gather around them, we support them, we help them. However, when somebody has a mental illness, we sort of push them aside and we don't give them as much support as we would give somebody with a mental illness. And we do see this across the world. We even see that there are less psychiatric hospitals in South Africa than here, and still a big population. So a little history I want to go into is the APA, the American Psychological Association, which is like the huge, what we think of when we think of diagnosing people with mental illness. And they have a lot of criticism because the people who make up most of the APA are white, wealthy men. So critics always say that they don't know what it's like to be a minority or of like a different socioeconomic class. So they have a lot of criticism over their diagnosis and their symptoms that they have in the DSM. I just want to talk about some mental health stigmas and perspectives globally. So schizophrenia is the most severe mental illness, and we actually see that like cross-culturally. Schizophrenia is everywhere, and it's not something that we only see in the United States. However, eating disorders, it's actually really interesting because that used to be a predominantly white, upper class, American female mental illness, but we were seeing that like spread across the world, and it's infiltrating like a lot of Asian cultures more so than within the past like 10 years. In Native American culture, we see this idea of third gender, and people who have third gender are considered to be like of higher power and more godly, but however, the DSM would diagnose them with a mental illness of gender dysmorphia. And I'm going to totally butcher this one, but it's Buffets de l'Errant. And we see this in places that were colonized by the French. And it's basically, the DSM would consider those people to be schizophrenic, but priests would just say that they are possessed by like a demonic demon. And lastly, I just want to end, I see like a lot of overlap between the Universal Declaration of Human Rights and this, because who's right in this situation? Like, are all people mentally ill, or is there like a godly component? Should we be infringing with the APA and the DSM on people's mental health? So yes, thank you. That's something for you guys to take away.
Before you walk away, how did this, in your paper, how did this connect to your QU301 and QU301 experience?
So when I came into Quinnipiac, I wasn't sure what I wanted to do when I grew up, but between QU101, 201, and 301, I've seen the world through a different lens, I think, and because of that and seeing how you as an individual affects the community and then towards a global level, that's made me want to pursue psychiatric nursing, because a lot of people need help all over the place that are suffering through mental illness, and they're not seeing support through their community.
And why was this topic, why did you pick this topic?
I actually picked this topic because in one of my sociology classes this semester, one of the chapters had a whole section about things that are considered mental illness here, but not considered mental illnesses in other places. So that's what really inspired me to do this presentation. Well, thank you so much.